Hey, hi guys. Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're having a good day, a good night, a good week, wherever you may be in the world. I certainly am. Right, now this video, it's not about politics, but it's about a situation that is happening to one of our world leaders. And I want us to discuss this because it's become a global issue. So I think it's an ideal opportunity to do a little bit of education on Parkinson's disease. So Lynn, you're going to ask me or talk to me about this situation that's gone global.
Yeah, so obviously, if you're not sure, we're talking about our president, Joe Biden, who's running for re-election. And some stories have been coming out about his cognitive ability. And there's a doctor who's a board certified neurologist who's going on television and in the United States talking about how he thinks Biden probably has Parkinson's disease. So first, let's talk about what is Parkinson's disease? Is it dementia? What does that mean?
Okay, so Parkinson's disease is a movement disorder. It's not dementia. It's a neurological disease. And you have a part of the brain, which is right in the center, called the substantia nigra. And it's that part of the brain that is affected. It affects movement. And that's why it's regarded as a movement disorder. It isn't dementia. Dementia falls under the neurocognitive disorders, neurodegenerative disease. We can say that Parkinson's disease is also neurodegenerative because it is, but it isn't dementia. How does it affect people? Parkinson's disease slows down the person's movements. So they may have a slowness in speech. They may try to walk and it's what's called a cogwheel movement. They get stuck, they can't move, they become very unbalanced. There's a risk of falling. People freeze, that's a possibility. Their facial expression becomes so, and if people have seen Biden, they would have seen that exact thing happen to him because he does freeze, and that is a Parkinsonian symptom.
His face goes blank.
Yeah, and that happens with Parkinson's. They have, if anybody remembers Muhammad Ali, in his later stages of Parkinson's disease, his facial expression never changed. It was stuck in one place, and it's a very serious look. And although he was being humorous, you wouldn't see that on his facial expression. But internally, he was smiling, he was laughing. But you won't see that externally. So that's Parkinson's disease, and it comes with tremors. It used to be called Parkinson's chorea because the people will shake with Parkinson's. That was the chorea, but we've dropped chorea from the name of the disease, and it's Parkinson's. It's PD now. So that's a very brief and very crude fundamental explanation about Parkinson's.
Okay. Thank you. So this doctor says that he sees people like Biden 20 times a day in clinic. He said it's ironic because he has, quote, the classic features of neurodegeneration, word finding difficulties, and it's not the, I couldn't find the word, that's from generation of the word retrieval area. So how can he say that? Or why is he saying that?
I think what that neurologist is identifying, and when Joe Biden became president, when he won that election in, was it 2020, wasn't it? So he won the election in 2020, and all my colleagues and peers working in neurology said that he is showing signs of something neurological or neurocognitive. And over the 4 years, you've seen that change, you've seen that progress. So what I think that neurologist has identified is what the rest of us have identified, in that there is dementia also accompanying his Parkinson's disease. So now it could be Alzheimer's disease, but it is likely to be Parkinsonian type dementia. If he has Parkinson's, then his neurocognitive disorder is more likely to be a Parkinsonian type dementia, which isn't really any much different to other forms of common types of dementia. So Alzheimer's disease, very, very similar symptoms and progression.
He's saying that Biden's stutter could be a reason for him sometimes stumbling on words, but he insists that the cognitive concerns combined with repeated physical behavior point towards something more than the stutter. He cites his rigidity in moving and soft voice as physical symptoms of Parkinson's.
Mm-hmm.
So if Biden has Parkinson's disease, he could also have a Parkinsonian type dementia.
Yes.
If he has a Parkinsonian type dementia, he could also have Alzheimer's.
Quite possible.
Quite possible.
Yeah.
Okay.
It could have any kind of neurocognitive disorder, but because, and I agree with that neurologist, I think there is evidence of Parkinsonian type symptoms, and if that is the case, and you've watched that progression over the years, it is deteriorated over those times.
Mm-hmm.
And it also fits that every now and then he's on point. Every now and then President Biden is on point. He's clear, he's concise, his speech and language is clear, his thoughts are clear, and he's on it. And that will also fit with a Parkinsonian type dementia and Parkinson's disease.
Okay. So it can fluctuate.
Yeah.
His lucidity, his
with
physical ability.
And we see it in a lot of forms of dementia. Yeah. And especially Lewy body type dementia. And there's another thing. We Parkinson's disease, Lewy body type dementia, there's overlap between them. So who knows? He could have Lewy body type dementia and not Parkinson's disease, because the presentations in the early stages are very similar. And because with Lewy body dementia, people may fluctuate from day to day, hour to hour. So at one moment, they can't do anything. They can't, if you've sometimes seen President Biden where he does freeze and where he can't answer questions and where he mumbles. If anybody saw the debate, they would have seen that happening during that debate with him and former President Trump. So I think there's a possibility as well, or a question mark over whether or not there's Lewy body dementia, because that would also fit with him having an occasion where he's just not there and an occasion where he's on point, where he's just 100% perfect.
Okay. Do you agree with this doctor who says he thinks both Biden and Trump should take a 4-hour neuropsychological testing, which is the hallmark test for cognitive performance? Do you agree with that? Not getting political, but as a doctor to diagnose what's going on. I know we've talked in other videos about MRIs and lumbar punctures and blood testing, but what about neuropsychological testing?
It depends what his motive is for that. With President Biden, definitely. But his press secretary is adamant that he has had testing with a neurologist 3 times whilst he's been in presidency. So it depends what the motivation is behind suggesting a neuropsychological test. As far as we know, former President Trump isn't experiencing any kind of dementia type illness. However, they are both way over 70. We know that President Trump's diet and lifestyle isn't very good. You know, he loves his McDonald's, he likes his Big Macs, but he plays a lot of golf. So he does get a lot of exercise. Not too sure what President Biden does. And if you think back to, I think it was maybe the beginning of last year when President Biden got on a bicycle and he fell off. People may remember that. So that's another indication of what's happening there. I'm not too sure about Trump, whether former President Trump has experienced any of those things, because obviously all the attention is on President Biden. So it would depend on that neurologist's motivation for suggesting that.
Okay.
But because, you know, when we hit 70, that's when we start to change. And that's when the brain starts to change and we start feeling the changes of aging. The aging process kicks in, senescence as we call that. Might not be a bad idea, but depends on his motivation.
Okay, let's put it another way. If you were brought in to examine Biden based on everything you've seen, but based on the information you collected during an appointment with him and his family, close family, would you recommend a neuropsych testing?
Yes.
To diagnose what's going on? To assist it.
Yes, yes. Along with the battery, a whole battery of tests. That's usually the standard. You know, if you go for an evaluation for potential dementia, then that is usually part of the process, the neuropsych testing.
Okay, and you've hit on they're both over 70, but as we've talked about over and over in videos, and I just want to underline this, dementia is not a normal part of aging.
Correct.
Neurocognitive decline is not a normal part of aging.
Correct.
So the age doesn't matter.
Mm-hmm.
A person could be 85 and be president and do very well and function great. A person could be 45 and not be able to function well based on having a neurocognitive disease. So it's not a normal part of aging, but based on what you've observed, there is something likely going on that's more than just jet lag or a cold or over preparation or just normal aging. There's something else.
Definitely, yes. Agreed.
Okay. And then to be political for a half a second, do you think if he does have something like a type of dementia going on in his health, do you think that's appropriate for him to still run for re-election? Because people that I talk to throw out the term elder abuse a lot.
Let me answer that not from a political standpoint, but from a clinical standpoint.
Okay.
Yeah,
Buddy?
Buddy agrees. What I see and what I observe, and of course, remember this, right? We only get snippets of things, and AI editing is fantastic. I'm doing it now, see. Fantastic at doing things like that. You know, he might just stumble occasionally, but we see that as the main thing because that's what the media is portraying to us. Yeah. So we don't really have the whole picture. Only his neurologist has the whole picture, and only his neurologist is the one that is in possession of all the facts. However, from what we see and what we witness, and especially in the debate, because I think we have to think about the debate because that was not edited, that was live, that was a full program of President Biden and former President Trump having a debate. And what we saw there was indications and evidence of potential neurological, neurocognitive impact. So I would be recommending that his neurologist makes that call, makes that decision, and gives that advice, whether he thinks President Biden should run for re-election or not. And of course, the Constitution doesn't say he can and he cannot. Nor does it say that former President Trump can't run because of all his 34 charges that he was found guilty of. So we follow the Constitution, don't we, here? We're very proud of our Constitution in the US. So, yeah. But I think the answer to that, Lynn, is for his neurologist to make that call, to give that advice, and for the political party to follow that advice, and for President Biden to also say, I feel competent enough to run for re-election. And in one of his lucid moments last week, he was very clear. I am running for re-election and I am going to beat Donald Trump. So it has to be the call of his neurologist and the people around him.
Because you can see someone who clearly shouldn't be driving anymore, and you can make that recommendation, can't you?
Right.
So driving a car and running the country, I mean, they're both very serious things, aren't they?
Yes, they are. Absolutely.
So if you were his neurologist, would you encourage him not to run for re-election?
If
you were his neurologist.
If I was
his dementia specialist.
If I was in possession of all the facts, then I could make that decision. So yes, I would make that decision. I would say, you shouldn't be running for presidency because you're not fit to do that job. But then again, who has the knowledge of being a president of the United States? A neurologist doesn't have that. I don't have that experience. I don't have the knowledge. I don't know what it takes. So it's like we can tell if somebody shouldn't be driving anymore. We can do that.
Yeah.
And we can send them for an evaluation for that. And the occupational therapists who carry out those tests can tell us this guy or this lady shouldn't be driving anymore. It's more difficult, I think, isn't it, as somebody who is running the country. It's like, what right or experience or knowledge do I have of being the president of the United States to say, you can't do this anymore? Because I think all leaders, whatever you are leading, whether you're the CEO of Boeing, or whether you're the President of the United States or the Prime Minister of the United Kingdom, you are surrounded by people who advise you, people who are supposedly knowledgeable about what they're doing, and they're the ones who you rely on to advise you. So, difficult question to answer that, Lynn. Very important question, and I think his own neurologist should be the one that is feeding that information back, because he's had evaluations according to his press secretary. So.
Okay, so I think that the debate shed light on a subject that maybe some people around the world wouldn't have thought about, and might take a look at their own family situation and might notice some things that is going on within their family that might be, maybe there's a step in the right direction, so they can seek help if they think there's something going on with somebody in their family, if they display some of the behaviors that President Biden has.
Right. Good point, because this is a universal. They're talking about it all around the world, about President Biden's possible Parkinson's disease or dementia, or whatever people are saying. And remember, there's a lot of armchair doctors out there who have an opinion based not on clinical or medical knowledge. So But it's a good point because it's out there, and it's a world leader of one of the most powerful countries. So it is drawing a lot of attention. And I think it is, as I said at the beginning of this video, it is a really good opportunity to do some education on this very issue, on the issue of Parkinson's disease and dementia. So
what do you say to people who are watching this video and have noticed these things that Biden's doing that people are concerned about, and they've seen that behavior in someone in their family? What should they do first?
Immediately go see your primary physician. Immediately. If you don't want to do that, go find yourself a neurologist that specialises in movement disorders, or somebody who specialises in dementia. That's my recommendation. Don't let it go. Don't wait. Don't wait 1 minute longer than you need to. Jump on it straight away, because as I said again earlier in a previous video, the sooner we diagnose somebody, the sooner you get the right treatment and therapy, and the sooner you're able to manage the progress of that.
What if you're scared and don't want to know the answer?
That's human nature, to be afraid, to be frightened. But what is important to know and to understand is that these diseases are not like it used to be a number of years ago. There's been so much advancement in treatment and therapy, and identifying, diagnostic tools are amazing today. They have developed so much. So diagnostics are much more accurate now. And even though you have some fear and trepidation about hearing this news, you want to hear it. You want to hear it. You want to know what's happening to your body. You want to know what you can do about it. And there is so much we can do about it to slow it down, to deal with it, to manage it. And that's like every other disease and every other illness. People shouldn't get sick. It's not normal or natural to get sick. We shouldn't do that. We shouldn't get ill. We shouldn't get sick. We allow ourselves to get sick because of lifestyle, because of diet, because there is stress, there is anxiety, there is, everybody is working so hard. People are managing, they're trying to cope with all different stresses in life. So all those things feed into our physiology. And it is those things that are causes of many, many diseases within our system. So manage your life better. Think about you. Think about what is good for you. What makes you happy? What makes you contented? What makes you laugh? What makes you smile? Those are important questions to ask. Be positive. Stay in a positive state of well-being. If not, we end up in a state of ill-being, and our immune system will drop. And then we invite every bacteria, bad bacteria, into our world, and then we get sick. So manage your lifestyle better. It's very difficult because of the way of the world today, 2024. It's very fast moving. Lynn and I went to England for 2 weeks, and I can't believe we've been and come back, and I've been at work for a week already. Life is so fast paced that we sometimes need to step back, take a breath, and focus on self.
And I would like to add that not only are there more tests and more medications and strategies available, but there's also more resources available.
Right.
As
absolutely
yourself.
As I am one of them. Yes, there are. There's much more resources available. So there you go. I'm glad we talked about that, and I'm hoping that it's been educational and the whole universal issue has been raised. So thank you for that. Thank you for tuning in. Any questions? Feel free to send us a message on Facebook, Instagram, through our YouTube channel. Please share our YouTube channel, Facebook, Instagram, my website, drdanielnightingale.com. Share it with everybody that you know around the world. The more people we educate, the better it is. Thank you for tuning in. Before you leave me, remember to say it with me. Dump the soda.